Hi, I'm Melissa Stockyj, a nurse injector here at Cynthia Gregg MD Face and Body Specialist. And today I'm going to be talking about myths and misconceptions regarding injectables. There is a myth regarding body injectables. A lot of people think that only surgery is available to treat the body. Here at Cynthia Gregg MD Face and Body Specialists, our injectors are trained in advanced technique. We can treat many areas of the body, and I'm excited to share those with you today. The first part of the body that we can treat is the neck and chest. There is a procedure called hyperdilute radius, which is a collagen building procedure. We have a specific video on our YouTube channel that discusses the procedure at length, and that procedure is lovely to treat the neck and chest for crepey skin. The next area is the arms, or the crepey skin of the arms. Typically women, as we lose collagen over the years, 1% of collagen after the age of 25 will get crepey skin, skin laxity. No amount of exercise is going to work out crepey skin. Oftentimes we're treating the inner outer part of the arms. When we put our arms down and we have that crepey skin that starts to develop there, we can treat that with the hyperdilute radius that I discussed before. And also now we can also perform soft wave on the arms for crepey skin. Soft wave is an energy-based device that will strengthen the skin and the crepiness by producing collagen. It also has no downtime, which is always a bonus. Moving down the body to the abdomen where there is skin laxity, crepiness, and I'm not talking about skin that is excessive, but more so skin that can get crepiness even after exercise and diet. We can treat that with hyperdilute radius, which is a collagen builder, like we discussed earlier, and we can also use the heat-based modality based upon your anatomy. Of course, you want to see one of the injectors here to go to consult to determine if you're a good candidate. Moving right along down the body are what we call the muffin tops, or the love handles. And sometimes women, we carry subcutaneous fat in those areas, and it will stay there for quite a while. Even with diet and exercise, women hold little pockets of fat in very specific areas of the body. And that area can be treated with Kybella, which is an injectable deoxycholic acid, which dissolves fat. Now, that also can be used in the little pinch of fat that's by the underarm. It's called the preaxillary fat, and a lot of times when we wear a bra and it kind of pushes on that fat pad, diet and exercise often can't get rid of that as well. So Kybella is an easy procedure where you do not have much downtime except swelling or possible bruising, but after 4 to 6 weeks you'll see reduction, and then we often will have to do another injection based on the area. Now again, these are pinches of skin, not large quantities of subcutaneous fat. We also treat abdomen fat, and I'm talking about little pinches of skin. So sometimes above the cesarean section scar, women will hold on to a layer of subcutaneous fat there, and it'll kind of bulge. Without diet and exercise will not get rid of it. So injections of Kybella into that fat pocket is successful and life-changing for a lot of women. When I go to the back of the body, muffin tops or flanks, that the little subcutaneous part of fat that will stick above the belt of the pants or the waist of the jeans, that can be treated with Kybella. Now here at Dr. Gregg's office, we are meticulous in injection. We're skilled and advanced in training and technique. So we often will be conservative initially, have you come back for subsequent injections. Because it is a permanent fat dissolver, we treat it as such. And so it's really a great thing to have done in office in less than 15 minutes. And to see the results 4 to 6 weeks later is lovely. The next area is going to be above the knees, and that area sometimes we get a little fat roll, a subcutaneous fat roll, and it can be injected with Kybella as well. That will reduce 4 to 6 weeks later, giving a more fluid, smooth transition between the thigh and the kneecap. Hyperdilute radius, we get crepey skin above the knees, and we can do the collagen building modality there. It's going to depend on what your skin looks like. For example, if you just have a little bit of crepiness, we may be able to do the hyperdilute radius there to produce collagen. We can also do the soft wave there to have a heat-based therapy to stimulate collagen. We often can combine both modalities to give optimal results above the knees. The other thing is sometimes as we age, we lose fat in certain areas. So we'll almost have like little concavities of fat and spaces of indents in between. Sculptra is a collagen stimulator that can be injected into that area. And when that kicks in or stimulates collagen after 4 weeks, it gives a more taut look to the thighs. So again, assessment is key. It's not cookie cutter, nor are any of our injectables here at Dr. Greg's office. And then Kybella also can be used in the banana roll, which is the area below the buttock. It kind of looks like a hammock, but it's a fat roll that women get. And diet and exercise often cannot get rid of that. And what it does is as we age, the banana roll almost makes the buttock look like it goes in and blends into the thigh. So when Kybella is injected in the banana roll and it reduces, it gives this nice illusion of a separation of the buttock to the leg, and it almost looks like a little bit of a lift. It's very nice and flattering. Again, less than 15 minutes for the injection. And so Kybella can be used safely off-label in these areas with an advanced injector. In the buttock, specifically Radius, and I've been talking about this often, but Radius has an indication to do a safe gluteal augmentation. Dr. Wu is doing the gluteal augmentations with Radius that are ones that would look like surgical outcomes. Again, we're conservative, we're not looking to do anything drastic, but as we age, we lose subcutaneous fat, tissue, we flatten. Dr. Wu can do a consult for a surgical outcome. The injectors here, we can do a slight lift with Radius and a smoothing of the tissue. I know as we age, and we all know this, as women, we'll get the flattening of the buttock, or we'll get something called a hip dip. So what will happen is we'll lose volume in the back of the buttock and it'll create a space, and then the butt will almost look flat at the bottom. So when we inject Radius diluted into those areas, it not only lifts and contours, but it also produces collagen. So it's very long lasting. The added bonus is if it's just subtle cellulite, a lot of times what we'll do is called subcision, us injectors, where we kind of break up the cellulite dimples. If you want a cellulite treatment, Dr. Wu is the one to speak to. She does a wonderful procedure now for cellulite. The last area I'm going to talk about is the hands. The hands are actually very popular to get injected because hands can show age. Here at Dr. Greg's office, we are skilled in providing treatment there. We have two options. One is a collagen stimulating modality called Radius, and the other is just using a very fine hyaluronic acid like Restylane Lift to create softness and hydration. So it's all dependent upon what your anatomy warrants, what we want the outcome to be for your hands. But it's a lovely thing to get a hand treatment. Oftentimes you only have to receive it once, and subsequent injections are maybe every couple of years based on the patient's anatomy. So I hope you've enjoyed our presentation today, and if you stay tuned, my colleagues are going to talk about their myths and misconceptions, our estheticians. If you have any questions at all, please visit our website. Also, the link will be below to our YouTube channel. Lastly, we really appreciate you as patients. Our loyal patients, thank you. We appreciate you very much. And new patients, welcome. We all will treat you as family here. And thank you so much for joining our Patient Appreciation Day again today. And you can check us out on YouTube, our website, or just call the office to speak to somebody about doing a consultation. Thank you so much.